I want to talk about a book I read a few months ago called Outlive by Peter Attia MD. It has really changed a lot of my philosophy, or at least I would say it's enhanced a lot of my philosophy. I know that why would a facial plastic surgeon, a hair surgeon, talk about a book on health? Well, for me, it's an extension of what I do. Obviously, when you come to me and you want to look your best, two things. If you're living an unhealthy lifestyle, no matter what I can do, it may not make you look that great. And the second thing is you want to live long enough to enjoy what you paid for. I had a patient, I remember many years ago, who saved like 20 years for a facelift and finally came in and paid all her down payment, ready to do it. And she had cancer and she had to withdraw everything, and then she died within 2 years. So very sad story. It's probably one of my saddest stories out there. But a large part of this is we want to square off the curve, as Peter talks about. What essentially that means is we try to live as good a life as we can, and then we pass away, rather than slowly decline with debilitative diseases. Now, I'm not in a position to give you advice about how to live your life because I'm a surgeon. I'm specialized in the face. And also, I read this book many months ago, or a few months ago, I should say. It came out in March, and right now it's in July. So I read it about the time it came out. However, I would like to just encourage you to read it so that you can learn some things. And I can summarize a few points of the book, but in addition to that, I'll tell you sort of my health journey as well. So about 14 years ago when I returned, 14 years ago, I lost quite a bit of weight, about 35 pounds. I was about 205. And when I was in New York City for my training, because there was a lot of walking, I was relatively fit. I was not necessarily perfectly fit. But when I came back to Texas, portions are much larger here, and then you start eating too much, and then you just, the bigger you get, and then you just sort of let it go, and you don't care anymore. What's another 5 pounds? So fortunately, I've never gained that weight back. I'm not saying there isn't any weight fluctuations over that time, but I've definitely at least not gained back that kind of weight. I may have gained 10 pounds back or 5 pounds back, especially if I go to Italy or somewhere really good. I'm going to gain weight. And when I go to Brazil, I certainly can't pass up the pão de queijo, which means those cheese breads. If you've been to Fogo de Chão, you know that when I'm talking about those things that fill you up and you can't eat your meat. But anyways, my point of this is to just give you some general encouragement, inspiration about living a healthy lifestyle. I don't live a perfectly healthy lifestyle. Nothing is such a thing. I'm not a monastic or abstemious or perfect in how I live my life. But I think it's worth to discuss some key things. So one of the big things that Peter talks about in his book is exercise. He has a little bias over his lifetime. He's always been inclined toward exercise. I'm actually disinclined toward it. I'm not very good at athletics. I've never been. I remember the horrible experience as a teenager being the last to be picked on a sports team. Fortunately, I'm good in surgery, and fortunately, I'm good at the things that I'm good at artistic things. We all can't be good at everything. However, the one thing he emphasizes is the importance of exercise. So the key things that he tries to take away is, if you think about people as they get older, by the time they hit 70 or 80, they barely can walk and they barely can go up a flight of stairs. And the reason why is that their muscle mass is so weak and they haven't really trained themselves there. He calls it sort of the centenarian decathlon, and he has these types of exercises that he recommends to help make someone stronger. So the point of this is to strengthen your muscle mass. So for me, I had a frozen shoulder issue on one side followed by the other side in the last few years. So the second time was actually caused by being overzealous and trying to lift weights. And the frozen shoulder is a condition that creates a tightness in the shoulder, and then it dissipates over 18 months. Fortunately, I'm out of the woods on the side. Hopefully it doesn't occur again on the other side. But I wasn't really doing a lot of weights, to be honest with you. I was focused really on cardio, and I think cardio is still very, very important. You have to have a very fit heart. But what he talks about is, as a primacy of importance, is to strengthen and build your muscle mass. There was a study that he cited, I can't recall if it's in the book or in his podcast, which I also encourage you to listen to, called The Drive, which is, they're actually quite long, oftentimes 2.5 hours, and he uses a lot of abbreviations in the podcast that are quite difficult if you haven't read the book yet, and it's hard somewhat to understand, in my opinion, even as a physician. But nevertheless, he talks about a study where I can't remember the age group. It was probably in the 60s, where at that point when you were at that age, even after a lot of muscle training, they couldn't build the muscle mass back. And that was a real negative, long term in terms of, if you wait too long, it's more difficult. I'm not saying you shouldn't, in your 60s, 70s, start muscle training. You should, absolutely, despite whatever the study is. The point of it is to start as young as you can and build muscle. And I'm not talking about bodybuilder muscle. We're just talking about as much muscle mass across the entire body before it becomes more difficult. So he says, like, if you can barely go up a flight of stairs at 40, by the time you hit 50, it's going to be significantly worse. And you can imagine what it's going to happen at 60, then 70, then 80. And this is what's happening right now, is we are barely making it to wherever we are, where we have to have a huge margin. He talks about VO2 analysis, which I really haven't done for a while. To be honest with you, my VO2 is not the best. Ideally, it would be more in athletic levels. I'm not that level. But the biggest thing I took away from this book for me personally was to incorporate weight training. Now I use Peloton, the fitness app, and I have a tread, and I've got the bike, and I've got the row now recently. So I work on all of these things to build muscle, as well as using weights and that kind of training. So the take home for me was build muscle mass early and frequently, and don't give up, and don't wait until it's too late. The second thing he talks about is really, and like he talks about like an hour of training. I don't do that. Honestly, I do 20, 30 minutes. I try to get through my different heart zones, and during the week I try, if I'm doing a delicate, like today I was doing a revision rhinoplasty, if I'm doing things that are more delicate, I'm not doing a lot of upper body work so that I don't have any handshake or anything. But if I'm doing non-surgical days, weekends, or light surgeries, I will be doing more upper body weights or lower body weights to get things stronger. So that's one category, is sort of, I encourage you to be more physically fit. I'm not going to talk about zone 2 training, which talks about different low heart rate training, high heart rate training. And there's so much stuff in there that I'm actually in the process of rereading the book right now and highlighting some key messages and ideas. But that's just a general category. To me, it's something I've been doing for quite some time now, is working with a really good physician. Now, the key is to at least get an annual physical. If you're not getting one, you need to. And beyond that, so you have to do the basics. The problem with allopathic medicine, which means medical doctor, MD like myself, is that they don't really, if you don't have cancer or heart disease, it's very difficult to do anything. They just say, okay, you're fine, you're good enough. But good enough is not really great. One of the things he talks about with cholesterol is getting a cholesterol. Now, his numbers are, to me, outrageously low. I'm sure they're great. He wants them to be at neonatal levels, like a cholesterol down to 30s or so. But what my physician, so I'm going to intermix a little bit about my philosophy with my physician's philosophy, not just Peter's. So they're going to be a little bit of differing with his. So I'm not quite as radical, but some of the studies that my physician who takes care of me, who's really smart, is to try to get an LDL, which is the key thing, and Peter cites the HDL cholesterol, really not having long-term studies to show that a higher HDL, which is always good, but just not confirmed through studies to increase longevity, but trying to get an LDL below 70. I was opposed to using statin drugs because I thought they were chemicals and they're not great for my body. But my physician and Peter have convinced me that, and I've been using it now for a couple of years, is that statin drugs are an important element in terms of longevity and in terms of reducing your cardiovascular risk in a very low trade-off. And of course, if you've got joint issues or elevated liver function tests, that may be an issue, but you're very low incidence of that. You can change it or titrate or do whatever it is, but you really want to get your LDL below 70, and you really want your triglycerides low as well, 100 below 100. You want everything as low as possible in terms of the cholesterol. I know there's been some controversy whether cholesterol makes a difference, but in terms of long-term studies, it appears that statins are a very, very important element. Unless you simply don't have elevated cholesterolemia, hypercholesterolemia, then that's obviously fine. And as Peter says in his podcast, this is not giving medical advice. Always check with your physician. As I already put a disclosure, I'm not a functional medicine doctor. I am not a trained cardiologist. I'm just giving you parameters and summaries of the book and some of the experiences that I have done that have helped me out. You can take it or leave it and find out what you think is good for you. I did a calcium score for my heart to look at how much plaque is in the heart. Fortunately, mine is on the low side, but it's worth looking at that. Peter talks about a lipoprotein A and to look at cardiovascular risk. Unfortunately, mine is on the higher side. There's not been clarity in terms of the importance in Asians or non-Caucasians, but still that is something that's important. So looking at also all different types of lipoprotein E, to lipoprotein E for Alzheimer's risk, etc., and trying to, or ApoE to look at the genetic risk for Alzheimer's. There's a whole section of that. I'm not going to go through all of that. And ApoB for in terms of risk in terms of cholesterol, low cholesterol, LDL. It's sort of a conglomerate of the different types of apoproteins or lipoproteins. So in other words, what I would recommend for you guys is get a biochemical evaluation if you haven't gotten one. I get mine every couple of months here because fortunately I work in my own office. My nurses can draw my blood, but I would encourage you to check your numbers as frequently as possible, not just once a year, as a good feedback on where you are health-wise. And really also liver function tests, cholesterol numbers being very, very important. And consider a statin drug if it's appropriate, and really look at base a calcium score for the heart, no matter your age, even if you're 35. Sometimes they found that even like during Vietnam when they had soldiers killed, that there was already cardiovascular disease in your teenage years. So you really want to look at your scores to see what's going on. The issue with this is if you don't have that, you're working in a blind box. You don't know what's going on. And they're dirt cheap now. They're probably $150, $200 out of pocket if you're going to pay out of pocket for it. There are other more advanced things like what Peter is a big fan of is the CT Angio. He says that you're going to miss about 15% of lesions because you only see hard plaques with a calcium score. My doctor has said that it's probably overkill right now to do that, especially because I have a low calcium score, but Peter is a big fan of this. There's a little bit of risk there. He goes through in one podcast a big, long, detailed discussion of which CT angios have very low radiation exposure, which ones have higher radiation exposures, which ones are unacceptable. I have not done a CT angio. I've only done the CT calcium score. But I think that's an important element. My physician is recommending for me just to rule out like an aortic aneurysm or anything else, even though I don't have any symptoms or not found anything on physical exam. Valvular evaluation. I'm getting just an ultrasound to look at everything. I've done a carotid ultrasound to look at my carotids, which are clear, but it's good to check that as well. So these are just basic imaging that go beyond just checking your glucose. Unfortunately, a large majority of Americans are overweight. I'm not going to go through really diet. That's obviously important. I'm not here to lecture you about all different types of diet, but diet obviously is critical in terms of health. I would recommend also a colonoscopy, especially if you have a family history of colon cancer. You should start young. I don't know how young because I'm not going to tell you. It's got to be 35, 40, 50, but don't wait until you're 60 or 55. It's such a preventable disease. Peter scares you a little bit and says that even after a colonoscopy 6 months later you could even miss one. My physician says that that's not really the case. He says that it really takes about 7 to 10 years to grow. He believes that polyps are something that grow very slowly, but for example, I had a polyp that was precancerous that was detected. I had either one or two, I don't remember, but so I'm going to go back at 4 to 5 years based on my GI recommendation, and my family physician who takes care of me principally says that's a little overkill. To me, I'm fine with it. I'd rather be overkill. Clearly if you're in your mid-80s and there's a risk of the sedation being issues, Peter does caution about, weighing it in terms of your overall risk. But when you are on the younger end, I would say it's almost never too early to do it, to consider it. But of course, have that consultation with your physician who's helping you. Now, a lot of physicians are trained in the old school way, just like me, which is really just to stave off. They don't look at staving off cancer or heart disease. All they look at is just at the end of the day saying, look, okay, you're good enough. You know, your liver function is good enough. Your glucose is sort of good enough. Peter's a big fan of continuous glucose monitoring. I've not done that. It looks at insulin spikes, and my stepsister is a big fan of that. I know that she's been doing that, and it helps you sort of look at what kind of foods are triggering responses. I do intermittent fasting. I know Peter is not a big fan of it. He says that with intermittent fasting, you lose muscle mass, and that's, well, obviously, as I just started this whole video, can trigger someone to have less muscle in their body, and therefore predisposes toward an atrophy. Although there is something called autophagy, which basically means that if you are off food for long enough, that your body will actually sort of self-regulate and clean itself. So for me, I have a tendency to want to eat more because I love food, and so the good thing is that I don't think of food when I'm at work. So for the entire day, I don't eat, but I drink water and stay hydrated. And after I work out, I take amino acids, perfect aminos. I don't have any affiliation with anything I've mentioned, including Dr. Attia's book or anything I've commented on in this video. They're just meant for your edification and education and hopefully inspiration. So I try to take aminos so that it doesn't break my fast. And there's also Prolon, which is my friend here actually in Dallas, who came up with that therapy, which doesn't break fast and helps maintain your muscle mass. So clearly intermittent fasting, it may not work for you. Peter is not a fan of it anymore. I still do it. It works for me for so far. I think it's helping me maintain my weight and my health, but maybe I'm wrong. Maybe I'll have a different opinion. I'll shoot another video in 6 months and say that was a mistake, but I've been doing it for about a year now. And I try to supplement with amino acids to get ongoing muscle stability, and after I work out in the morning. And I just eat once a day. Now on the weekends I have my kids and all that stuff, so I just, I eat 3 meals, and when I go on vacation I eat 3 meals because there's nothing to do. And in a way I'm glad I'm not retired, because I'd be so bored I'll be eating all the time. He does talk about the end, just emotional health. I think that's a huge component, the whole thing, which is something that I'm not going to go into, but he had a lot of anger issues. I had anger issues as well in my 20s, and I think part of it was just growing up in Texas. During the 80s, there was a lot more racism, at least overt racism. I got a lot of fights. Was something I'm not proud of. People called me the C word, and that's chink. And just how to deal with a lot of that insecurity coming forward. I think it translated into some anger issues in my 20s, just being very verbally abusive. I was never physically aggressive. Given my frame and my size, I'm not going to go be punching someone, otherwise I'm going to be beaten up. I did get in fights in my teenage years, but he talks about just emotional health. For me, I feel like I'm from an emotional level, despite stress, things like that. I feel very, very grateful. Gratitude is a huge part of it for me. My wife and I pray every night and thank God for what we have. I'm very, very grateful for my children. They're amazing kids. Of course, I have a bias. I'm so grateful for so many things in my life, including a passion for art, a passion to be able to paint and have the talent to do that every day, a great wife, a great life, a great job that compensates me well, but also provides a lot of satisfaction in my life. So those are some big summaries of the book. I have so much more into it. I'm missing probably 90% of the book, but this was just meant to talk a little about how my philosophy intermingled with Peter's, also sort of how the book has helped me and how I utilize it, and hopefully there's some resonance, and hopefully you can live a better life after listening to this video.